Good afternoon, Surya sir.
Good afternoon, Anil ji.
Sir, we will be starting shortly.
Yeah, please try to start timely.
Good afternoon, Raji sir. So very good afternoon to all our distinguished dignitaries, our panelists and our participant. I am Anil Kasher, Technical Officer, Emergency Management, PHS CDC India, and I welcome you all to today's webinar that is on community engagement in public health, emergency and disaster management. So this is the 14th webinar of ongoing webinar series on public health, emergency and disaster management during and beyond COVID-19, building resilient workforce system and infrastructure in India. And this series, it is mutually initiated by National Institute of Disaster Management, Ministry of Home Affairs, Government of India, National Center for Disease Control, Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India, and US Center for Disease Control and Prevention, Country Office, India. And all the valuable directions comes from the patrons of the webinar series, Shri Taj Hassan, IPS Executive Director, NIDM, Dr. Sujit K. Singh, Director, NCDC, and Dr. Meghna Desai, Country Director, CDC, Country Office, India. And also critical inputs are received from the co-chairs of this webinar series, namely Professor Surya Prakash from NIDM, Dr. Himanshu Chauhan from NCDC, and Dr. Rajesh Sharma from CDC, India. So coming to today's theme of today's webinar. As you know, communities, they are first victim as well as they are also the first responder to any kind of event, whether it is related to a public health emergency or disaster. So therefore, our communities, they are the critical resources that should be effectively utilized during any emergency or disaster. So, and universally, it is also accepted that a well-aware community can better understand the risk beside effectively adapting the preventive measures or practice. So we need to foster the efforts to build on the community engagement activities to better preparedness, planning, and more efficient and timely response. So today we have two eminent speakers, Professor Surya Prakash, Head EOC, GMR, and CBRN Division from NIDM, and Dr. Rajesh Sharma, Public Health Specialist and Lead Emergency Management, CDC India, and both will be enlightening us with their vast knowledge and expertise. So in our technical section, there will be two presentation and sorry, each speaker will be having 25 to 30 minutes. So each speaker will be having 20 to 30 minutes to share their experience and expertise. And there will be also a Q&A session as well, where our experts will be resolving your doubts. So participants are requested to make the flow of knowledge bilateral. And please do raise your questions for that. Either you can use chat box or you can also use Q&A box. And in between, we also be sharing a feedback link in the chat box. So you are also requested to kindly share your thoughts by filling that feedback form. So moving for the first presentation today for first talk, we have with us Professor Surya Prakash. Professor Prakash is presently working as head emergency operations center as well as GMR division and also CBR and industrial and CBR DRR division in NIDM. Beside, he is also a team leader for World Center for Excellence on Landslide Disaster Reduction as well as faculty in charge of 80 specialized centers, Center for Early Warning Communication, Safe Hill Area Development, Coastal Disaster Risk Reduction and Resilience Emergent, as well as flood monitoring cells, CBR and Industrial DRR, as well as Cyber DRR. So with this intro, I pass on the stage to you, sir. Over to you, sir.
Thank you, Anilji. Please, yeah, thank you. First of all, good afternoon to all the dignitaries of the inaugural program, the delegates and the participants. I welcome you to this program. Is my screen visible now, Anilji?
Yes, sir. You are.
It is visible.
Yes, sir. Yes, sir.
Okay. So let me start directly with the presentation on that theme of the today's webinar, community engagement in public health emergencies and disaster management. I'll share some of my experiences with all of you and then elaborate you how we have actually tried to engage communities in the process of public health emergencies and disaster management in different disaster situations. Okay. Just before I come to the main theme, I'm sharing some of my experiences during COVID-19 over the last 2 years when the pandemics had initiated, then spread out, then contained, and a lot of community engagements were seen at that time. Without their participation and involvement, it would not have been possible to actually contain and control the spread of this disease. So one of the women leaders who came forward in the no COVID-19 management was the Amma canteen ladies who provided the food to the victims and the affected families during the COVID-19 when there were no choice to go outside of their homes. So they continued their services for the communities and helped them survive in the COVID-19 crisis situation. The other point of contact where communities were very much involved was the market areas in between the lockdowns when the market was getting opened up. The communities who were particularly the shopkeepers and the people who were buying buyers the different items from the supermarkets and some such areas where most oftenly we are seeing the crowds. What we found, these communities and the shopkeepers particularly, their communities actually decided to provide the services for home delivery through different means, as well as within their own premises they try to maintain the COVID-19 protocols and try to provide all the necessary sanitization process and the materials at their uh, premises. Similarly, even in the high-rise buildings and other multi-story complexes, even at the outside of the lifts, they did provide those services. So this is how communities actually try to get themselves engaged in the pandemics management in different ways. Even the shopkeeper who was trying to deal, he was keeping the sanitizers and using them well and using the remote methods of transactions rather than direct money transactions. And this is how these communities they try to maintain. You can see a person from Zomato also in the shopkeeper shop who is actually helping the communities to get the the items from these complexes to their homes. And wherever they were actually involved, I could see that they were keeping the uh, distance desired amongst themselves. That was about 2 meters amongst each other, and also taking care of the old people. You can see an old person sitting on the chair while the younger people, they are standing in the queue. So this is how they try to maintain the balance in the community and help each other. So these are the scenarios where there are positive sides. I can also share some of the negative sides of our communities where people ignore and become sometimes careless and lose those cautions which need to be taken care. At the same time, I'm showing you the situation where in the market area, some of the people, they didn't follow the COVID-19 protocols and the compulsions of the people to travel together and without maintaining the distance that was desired. And in the market area from where all the food eatables will come, the lot of activities used to be continued during this period. So all these places where the communities, where be it the traders, be it the industrialists, be it the residential communities, or any other communities which were there, they actually work together to ensure in this market area also. This is a wholesale grain and food, vegetable, fruit market area where they maintain certain protocols, and they decided what would be the suitable time, what should be the interval time, and how the drivers should maintain their health conditions to not to allow to spread the COVID-19. And the outsider, migrants, laborers, everywhere, whatever communities, whether the local residents or the outsiders and the migrants, all had actually tried to maintain the discipline and follow the protocols. The other good thing that happened was the media community, which also brought information which was correct and reliable through our emergency operation centers. We have been talking in these webinars about the public health emergency operation centers and how effective and uh, no good they can be in terms of their services and utilities. You can see that all the media people, they were focusing on the information being shared and disseminated by our officials. And these were the officials, those in those emergency operation centers, who were updating the database and actually coordinating and sharing those information with the concerned responsible officials. And further to this, at the local level, the local authorities, they also interacted with those communities and also empowered them. You can see a lot of people, doctors, physicians, psychologists, and security personnel. They were all sitting together to help the masses at large, and they were providing services to the telecounseling centers during the COVID-19, and also sanitization of the market areas during the non-working times, and using the technologies like drones for their own areas, surveillance and monitoring during the COVID-19, keeping database and manufacturing the masks, the sanitizers and other materials for their own consumptions at the community levels. So these are the some of the instances I shared with you, which we witnessed during the COVID-19 during the last 2 years. But as said by Mr. Anil Kathat, the communities are the first sufferers as well as the first responders. All others will reach late or afterwards, but those who are in place, they have to become the first responder. For therefore, their level of awareness and preparedness will actually make a lot of difference in terms of the impacts of those disasters, and also in reduction of the incidences of the disasters. I listed down many parameters, but since The time is short to deliver and talk on each of these points. But basically, we depend upon the community level engagements and strengths is their own traditional and local indigenous knowledge that they possess by virtue of living in those areas and experiencing different kind of conditions that they come across during the period of their stay in a particular area. And also the community's interactions with each other and knowledge about each other is very much helpful. And in disaster period, it's a culture in Asian countries to help mutually and try to address the problems in their own areas. So this statement actually came from the former UN Secretary General Kofi Annan, who had said these words that communities would be better able to participate in their own disaster risk management process and ultimately improve their ability to cope with disasters if they are better able to identify their disaster risk management needs and methods of preparing resources to meet those needs before a disaster occurs. So we tried to actually test it and validate it through no through it you can say test mechanism which we followed up in some of the villages in Uttarakhand state, and with the aim to actually establish a community-based multi-hazard and vulnerability assessments for planning integrated risk management. The main objective of the approach was to make communities aware, informed, and prepared for coping with disasters. And the second objective was to protect, and promote safety, health, and quality of life on a sustainable, equitable, and right-based approach with good fraternity amongst all members of the community. The basic methodology and tools for even for the communities were similar to what we usually do in our scientific, technological, and management communities. We did consider the hazards that are taking place along with the exposure, vulnerability, and value of the elements which are getting exposed to those hazards. Also, we did consider the capacities among the communities to face the challenges of these disasters. So this thought came actually when we were discussing that under the Disaster Management Act, we are considering the 3 levels of disaster management planning, from district disaster management plan to state level disaster management plan and national level disaster management plan. But some of the minute details, they are lost in those plans because of the larger geographical areas or higher concentration of population in those areas. So therefore, the plans were considered to have certain shortcomings, which I have just mentioned few of them, which include the same plan being implemented at all places with all communities, with all cultures, and also non-consideration of the indigenous and local traditional knowledge, experiences, skills, resources, because of the wider areas and versatile nature of those plans. Negligence of the local cultural instincts, even the acceptance of the food, the clothing, and living styles, they are very different throughout the country because of the wide geographic spread as well as the climatic conditions and the cultural and socio-economic diversities amongst our communities. Local communities actually sometimes even do not know about the details of those plans or the existence of those plans because they have either not accessed those web links where these plans are available, or these have not been discussed and derived and developed with their participation and partnership. So therefore, if we will go ahead with the community engagements and community-based disaster risk management planning, it will help actually bring the feelings of coordination and self-belongingness of the society those plans, and also it will be able to consider the geoclimatic and socio-cultural characteristics. Local initiatives will also begin, and there will be an exchange of knowledge, information, skills, and techniques amongst the experts and the communities, because communities will actually dwell upon their own strengths, while the experts will bring in their practices and policies from the other areas which they have been working upon. So the suitabilities and also the community's abilities to monitor and keep a watch on the works being undertaken for the disaster risk reduction and resilience with a greater sense of responsibility than uh, uh, being done with the general responsibilities. Capacity building of the communities that need to be focused and brought out with the issues for safer developments and coping strategies. We approached these development and practice of community-based disaster risk management in 6 steps. The first 3 steps we involved were the related to risk analysis, which included information on locality, community, and environment. So we tried to first develop the understanding of the geography, the climate physiography, and the communities, as well as the land and water and biodiversities over there. Then the second part we did was the spatio-temporal multi-hazard assessment, that whatever hazards have happened in the past or disasters have happened in the past over a period of time, all those were actually mapped and the data were collected and analyzed. Then the third thing that we did was vulnerability and capacity evaluation, keeping in mind the existing developments and infrastructure within those areas, the degree of the vulnerabilities of those elements which will be exposed to these hazards, which are likely to happen or which may be potential existing or emerging, and also the capacities in terms of their awareness, information, and preparedness, along with the necessary requisite resources. That all was done based on those data which was available. The next part of this community-based disaster risk management planning was another 3 steps, which involved the after assessments, the ranking and prioritization of the hazards, because it was realized not one, two, or three. There are multiple hazards, number of hazards, and they need to be prioritized. So therefore, the community's views were taken using the Vance diagram, the Chapati diagram, and other no crude scoring techniques which were used, and also the preparation, testing, and review of multi-hazard risk management plan. This was the next step after prioritization, and herein they actually utilized the different tools for community engagement, which included sorry, the rapid rural appraisal techniques, the participatory rural appraisal techniques, the participatory learning and action techniques, and participatory implementation and action techniques. So all these social techniques, sociological tools, sorry, they were used, and the plan was prepared, tested, and reviewed. And after that, the approval from the competent authority for implementation, monitoring, and evaluation was done. Sorry. Awareness campaign. Initiation of this whole process started with the folklores, drama, skits, and public meetings where all the local people, they were involved, and they were actually apprised and discussed about the problems that they have been facing in the past and the problems they are likely to face in future. And with their involvement, they were asked to prepare their plans for each of the villages. Around 50 villages we were involved, and the workshops were conducted for their hands-on training, for the practical training, for construction of disaster resistant buildings and infrastructure. And this you can see how they have tried to learn by doing. And this is how they created their own emergency operation center, which they actually called emergency operation, disaster emergency operation, and resource center. So that is they have created, and they actually uh, developed some materials, also inventory of the items for response to disaster situations. It's a very old photograph, because this community-based technique, it was tried way back about 20 years before now, and you can see at that time also it had worked very well. And they named that structure as Abda Pratikriya Evam Sansadhan Kendra, that is disaster response and resource center. And this is all we sat with the communities, we discussed with the communities. These are old real photographs, so they are not digital photographs, so that's why they are not very clear. But just to show you that these people, they prepared their maps, and we could even locate cracks which were not visible through any other means, using even our best of the technologies, including the aerial photography and remote sensing techniques, because the cracks were so small in size and dimensions that they could not be easily located without the human interventions. So that prepared not only the multi-hazard risk management plan, but also their evacuation and safe shelter route maps. So all these maps I can share and show you. There are number of such maps. All these villages who prepared in their own way, using their own methodologies, colors, drawings, and their people locally involved from those villages, working for their own DM plan. So these are all, you can see the different kind of conditions, and along with the plan of about 70 to 80 pages, they came out within a period of less than 15 days, with just 4 days training to them on these preparations and of the plans and the maps. Or maps, they are not exactly the maps, they are more the sketches, but they are also showing the north direction, and also the outlines of the village boundaries, along with the nearest villages and the essential facilities around them, or the emergency facilities around their villages. So you can see how good they have. They even named the road also. You can see the Kedarnath mark, that is where the tragedy took place in June 2013. So these are all, and then Prime Minister agenda I would like to mention with reference to the community engagement, and you can see the Prime Minister's agenda number 3 actually emphasized on greater involvement and leadership of women in disaster risk management. This is one of the points where community engagement in disaster risk management was emphasized by the Honorable Prime Minister during the post-Sendai First Asia Ministerial Conference in November 2016 from 3rd to 5th. And then also he mentioned 2 more important points with reference to the community's engagement. That is one in terms of social media applications, and the second was building local capacities and initiatives. So this focus is there, and we have been doing over the past several years all these with community involvement and multi-stakeholder involvements, talking about the lessons learned by different stakeholders, including the communities. And also I would like to highlight the cases which we can see that in terms of the communities' involvements in this generation and creation of disasters too. For example, the Pothingal temple fire, which took place in Kerala in the Kollam district, a lot of explosives, they were actually stored in one of the places close to a temple, where the one of the crackers which went and struck and caused casualties of around, I think, 140 people. And the kind of development the communities have been engaged in need to be actually brought in attention. So when we are talking about public health and disaster management, we need to see that appropriate spacing and appropriate safe situation and routes should be there. And for their training, we are also going to undertake some mock exercises. For example, here in this case, we are taking help from a health specialist for demonstration of first aid technique. And similarly, we are engaging the communities in the triage practices, where we can train them to identify the victims with different degrees of severities. And also, we are engaging them in terms of trainings on CPR and portability of the victims. So then not only that, we are also trying to train them in the technological base, utilizing the geographic information systems platforms, as well as engaging them in the field and telling them how and in what conditions can they be trapped in disaster situations, and how to survive in those situations. So the community's involvements and the capacities, they are very much important for reducing the number of the casualties and also the losses and damages from any disaster situation. And the community level tabletop exercises beside the field exercises are also bring more information and clarity to them in terms of coordination, better effective coordinations. And now our DM authorities, they are also taking steps to make the communities responsible in management of the safe shelters. For example, the cyclone shelters, the communities have been actually made responsible and engaged, and they are now upkeeping and maintaining these structures well. Similarly, in terms of their involvement, I can show you how we try to engage, and through the cultural means, we are involving them. So their sentiments, their emotions, and use with the help of NGOs and CBOs. NGOs mean non-governmental organizations, CBO means community-based organizations. We are trying to engage them well, and also using the media, particularly radio media. We are trying to spread the messages and telling this and sharing the information that how these communities in the affected areas, they can engage themselves in public health emergencies and disaster management. And this is very important, particularly where we cannot access them physically directly, in terms of mass, in terms of exhibitions and the fairs and other such public programs. Also, we are conducting the quizzes, puzzles, and also sharing information about disaster risk reduction and resilience, and the taking up their questions and providing them answers to their queries about the programs, projects, missions being undertaken by Government of India, and how the communities, they can engage themselves or take initiatives for their own safety, protection, and survival in disaster situations. And all these were discussed, and even at the kids level, there are games being developed to teach them about disaster management at the community levels, and keeping memories of the old disaster impacts to serve as reminders. This is one of the schools which were affected, so that the communities do not rebuild the same disaster again, and they take adequate precautions to build back better. And also, the communities are engaging in developing memorial sites for the disasters and the memory of the people who lost their lives. And you can see that how one of the examples I'm taking from Taiwan earthquake in one of the area where they had developed the earthquake national memorial site. And similarly in China, an earthquake which took place on 12th May 2006 in Wenchuan actually led to a lot of losses of human lives, and they created a memorial museum. And these kind of museums, when people visit and communities exhibit, it helps, and communities actually contributed to it. And they contributed all these that clock. You can see most of these clocks, they're displaying a time of about 2:30 p.m. And that was time when the earthquake struck and just stopped the clock. So these kind of things were observed and they established, and not only by the items, they did, even the artists, the painters, they are also making such paintings to indicate how the people worked, responded, and what was the situation in any disaster. So these are actually lessons, and I remember I had the opportunity to visit Wenchuan area after the disaster, and I could see that they maintained these damaged buildings as a no public visit sites to learn from that disaster of that particular event. So they rebuilt and with the better techniques and safer techniques for the safety of the people, but they kept the damaged building as it is, and for provided an insight to the people that how and what would be the result if we are not living in harmony with the nature and following the right practices for disaster safety and management. This is what we could see in those areas that were affected during the Sichuan earthquake, Sichuan province of China. And they are not only doing that, there are also the scientific community, they developed experience centers, science. You can see earthquake science experience center. You can sit in a room and you can have a jerk of an earthquake of about 6 or 7 magnitude, and you will see how you will feel like, and how the different elements within your building, they will respond to that particular disaster situation. And also prevention and education center. So you can see memorials, you can see parks, you can see the experience centers, and also the prevention and education centers being developed. In the prevention and education centers, they share the maps with different zones of the earthquake vibrations and the earth structure, composition, how the different plates they are actually jointed and moving against each other, resulting into volcanic and seismic activities. All these are different ways how the communities they can get engaged in public health emergencies and disaster management, but no one can actually face the consequences and challenges of disasters. So we have to build partnerships and then go ahead with that. And like the stone, which I often say, which I saw came across in Japan, where there are a lot of disasters, multiple hazards, they have put it in a crossroad, which they say you move in any direction, will quickly regain its position. And they teach their Japanese society that we are prone to earthquakes, tsunami, the pandemics, and all kind of disasters. So we must develop resilience to regain our position as quickly as possible after any disaster happens. And all efforts are made to actually prevent and mitigate any kind of disasters. So the same thing of social resilience, I think we need in India. And our dream as per national policy is to build a disaster-free and resilient nation with zero casualty. And this is my last slide where I have been actually supported by the communities at the local level, not only the administration and governance, but also the local NGOs, CBOs, the local level of people, hoteliers, they all helped. But the finest thing was the monkey with its baby had come to the car, which was provided by the son of the priest of the famous Vishwanath temple at Uttarkashi, where I was working for rehabilitation of a wildlife area in the forested land. So every sport was there, but often we say the wild hostile life, it also becomes hospitable and affectionate to you if you do good to them. So disaster management does provide us those opportunities, and our communities can actually engage themselves in health emergencies and disaster management and try to avert these disasters. Here I will stop, and I would request if there are any questions I can take now, because I have to travel, so I will be leaving the platform. after this lecture. So if any questions are there, I can immediately take and try to address them.
Thank you very much, sir, for your insightful deliberation, sharing your vast field experience on the engagement of communities. Uh, Sir, there are a couple of queries by our participant. Mm, When we are talking about community engagement, we should also look to learn from their indigenous knowledge as highlighted during the presentation. So my question is how we can integrate the indigenous knowledge in our present framework of disaster management.
See, whatever plans we are preparing at the local levels, if we develop those plans in partnership with those communities who live over there, because I don't even know, say that we should have participation of the communities. Participation is one way, that you are preparing a plan and getting them engaged for their inputs. So rather than engaging them, you put some stakes with them also in terms of partnerships in development and implementation of the plans. So that's the best way to integrate the indigenous and traditional knowledge into our DM plans. I didn't mention focused on that indigenous and traditional technologies and skills, but there are a lot of them.
Sir, one last question. How to mitigate the flood situation in valleys? This year, 2 times flood has taken place in Barak Valley and Brahmaputra Valley in Assam.
Again, I was showing you during COVID two sides of the community. One positive where we are trying to avert the incident and reduce the impact. Second, where we are encroaching into the disaster prone areas and trying to ignore the best practices for the community to follow. So here in flood situations in the valleys, floods are recurring annual phenomena and they are also required to happen as well, because otherwise we'll not get fertile lands and will not be able to grow better crops. So therefore, we should actually avoid encroaching upon the river channels and the water bodies, due to which often we are getting exposed to the adverse impact of the floods. So that is one. Other is we should not actually play with or destroy the embankments, and also keep a watch on them if there are any breaches and leakages, so that they do not let us down when there is overspillage of the river channels due to heavy precipitations. So there are some of the ways in which the communities can actually try to reduce the incidence and impact. And response also, they need to learn. They need to learn how to know swim and how to protect themselves in case they get trapped in flood situations. So they have to follow the do's and don'ts which we are prescribing from NIDM for floods and other disasters.
So that's all the questions from our participants. So on behalf of participant, I thank you for joining us and for sharing your vast knowledge with us and with our participant. Thank you very much.
Thank you, Anilji, and thank you all for providing me this opportunity. I wish all the best to everyone. Thank you.
Thank you, sir. So to further enrich our knowledge on the engagement, how our community can be engaged in public health emergency or in disaster management, we have with us Dr. Rajiv Sharma. Dr. Rajiv Sharma is an emergency management specialist, currently working with US Center for Disease Control and Prevention, CDC, New Delhi, and leading emergency management program, and also providing technical support to various multi-layered, multi-organization department institution under the government of India. So with this intro, I pass on the stage to you, sir. Over to you, sir.
Thank you, Anilji. Am I audible?
Yes, sir, you are audible.
Namaste, good afternoon, good morning, good evening to all our online learning community, wherever you are. and thank you, Anilji, for inviting me for this important topic. As Surya Prakash sir has already shared his enriched experience, knowledge, how communities are important, for managing any public health emergency or disasters, and especially he has, given some of the experiences from COVID-19 response, how community has been played and is playing a key role, in mitigation and prevention and mitigation of this COVID-19, and also, further spreading the transmission. I'll just share my slide. Anilji, can you see my slide?
Yes, sir, your slide is visible.
I will just. I have a low bandwidth, so I will just try to off my video so that
Sure, sir.
my slides are visible properly. So I will not talk much about what already Suri Prakash has mentioned, but I will just give a brief about the community, what are their needs, and how communities play a role in disaster or public health emergencies, prevention, mitigation, and as well as response. So giving some basic idea, as our online learning community is well aware, and they know about the community. Just giving a brief about the communities. A community is a unified body of individuals with common interest living in a particular area, such as village, housing society, district, neighborhood, and living together with common characteristics, interest, professional, and such as scientific community, common social state, such as student. And with that, would like to focus on our lesson learned. And as we have been moving and evolving with this current pandemic, and lot of things are happening so rapidly. One of the thing is paradigm shift from health emergency and disaster risk management framework. This is a framework uh, developed and released by WHO in 2019. And this framework envisaged that there are various factors in this from paradigm shift from one way to other way. But the major things are, we need to be from reactive to proactive, single agency to whole of society, and planning for communities to planning with communities. So this is, again, I would say that this COVID-19 pandemic has given us some lesson learned, like whole of government to a whole of society approach for management and response, and community, response. And this has been again prioritize, and many times our honorable prime ministers has given emphasis on how communities are important, and how to move from whole of government to whole of society, or whole of community approach for COVID-19 response. And community engagement is a blend of science and art. We must understand that we are going from this paradigm shift from event based to risk based, especially from an idea I want to give you is that we cannot work as a single agency. We need to work as a whole of society. And this pandemic has given us a lesson that no country is prepared. Even we have seen those high economic countries, or developed countries has suffered a lot with this pandemic. Even, some of the resource poor countries has performed so well. So many lessons learned from this pandemic, but we need to be prepared for, future pandemic. And also, where we are not planning for communities, we have to plan with communities, with the cities, with the people, with the society, so that, because community are the best one who knows their, their risk, their threats, their vulnerabilities. So that's why developing any disaster or public health related plan, always, planning with the community. Why and how work with the communities? Disaster and health emergencies generally take place in or impact communities like floods, landslide, cloudburst, fire, and the current COVID-19. Community members are therefore the most important stakeholders or actors. Building relationship with community members within the existing local structure can lead to a successful health emergency or disaster response. Most importantly, community is the first responder to any public health emergency or disaster response. Again, coming back to community-based actions, as Surya sir was also mentioning that the frontline protection is from the community. Why this is important? Why this is a need for building their capacity? Because, in community, what we have learned so far, the community, their local knowledge for their local risk, local actions, prevent the risk at the source, and also a well-prepared and active, well-organized community can save many lives in the first hour of any disaster or any emergency. Community capacity building and experiences. I would like to share some of the experiences with public health emergencies and disasters. As Surya sir has already shared, few of them. So any response to disaster or health emergency must have the active participation and involvement of the community. Let us discuss some of the positive outcome of community involvement in emergencies or disaster. One of the example is Dharavi slum, Mumbai. Because of the overcrowding, lack of knowledge, lack of adoption of COVID-19 appropriate behavior, there was concern that the problem of COVID-19 infection in migrant workers and the Dharavi slum of Mumbai and the slum of Pune would worsen exponentially. However, was the community involved to adapt the COVID-19 appropriate behavior using government of India or state governments or local governments guidance for hygiene practices, early reporting, isolation, early admission of at-risk patient or population in the health facilities, and infection was contained quickly. And because of the whole community approach, engaging with the whole community, healthcare worker and community both together, played a key role in the containment of this Dharavi, Slum Mumbai COVID-19 outbreak. And therefore, this is a good example of community participation for COVID-19 response, which resulted into a containment of that outbreak in Dharavi. And another one is the Fani 2019 and Amphan 2020. Similar event occurred during numerous natural disasters such as cyclones. And this is the good example from two, cyclone Fani 2019 and Amphan 2020. In Odisha, when early warning to the community and their readiness to leave high-risk regions prevented accidents, trauma, and fatalities. So this is, one of the good example how communities played a key role in, one of the question in previous talk, which was led by Surya Prakash sir, that, how to prevent and mitigate the flood, one of the prone area. So these are the example, how community plays important role. And tsunami ready villages in Odisha. In Odisha, India has become the first, nation in Indian Ocean to host communities that are prepared for a tsunami. The UNESCO Intergovernmental Oceanographic Commission, or IOC, has awarded the two villages from Ganjam district in Odisha certificates of appreciation and recognition. Indian villages have never received such distinction from UNESCO. So this is one of the example, how community by theirself and themselves played a role in building their capacity for disasters or emergencies. An early warning signal of plague, avian flu, malaria, dengue. One of the discussing point in this community engagement is that, community are they are the first responders. Another is also one example is community. They are the first early warning signal or early warning signal giving to the public health responders or to the systems, because they know what is happening in the community. They understand their problems. If any unexpected things are happening, any early warning things, uh, then they are the first one, who can report to the public health system or to the healthcare facility. So the importance of uh, early warning signals of plague, avian flu, malaria, dengue. This is the importance of spotting early warning signal of plague, malaria, dengue, avian flu, as well as preventing the effect of public health emergencies, is demonstrated by the community's prompt reporting of rat falls. We have seen during the plague, if any rat falls is happening, community they recognize, they see that why this is happening. Then this is one of the example. And also abnormal behavior and death of birds. We have seen in the bird flu time, community are the first one who reports, oh, why birds are having abnormal behavior and why they are dying. So this is one of the example. And also high fever rates and fever related deaths within the community. If in community they have childrens are having high fever, or in the community they have high fever, so and also related with death. So these are the some of the triggers and examples in point of public health emergencies or public health response or public health early warning signals. So community played an important role in that. During disaster emergencies, again, we need to understand in any disaster or emergencies or during disaster, community take information differently, they process information differently and act on information differently. And we have, learned lesson from this COVID-19. When COVID-19 started in early 2020, then that time, we do not have those information, scientific evidences, how to prevent this, how to stop, how to mitigate, and even no, diagnostics and no medical aid. However, over the period of time, those has been developed, and now we know how to prevent it, we know how to mitigate it, and for the treatment and diagnostic, we have all the modern tools and techniques, and now the vaccine is one of the tool for preventing deaths and also spreading the infection. And how to build the community trust, and how to make that communities knows what is right, what is not right. So therefore the right message at the right time from the right person can save lives. So this is very important, who is giving information to the community. So that is the very important part. Whenever any emergency happen, who is communicating, how he is communicating, and how community is taking that information. So we always try to build the trust of the community. Unless community has no trust, then our response will not be effective. So that's why be first. crises are time sensitive. Communicating information quickly is crucial for members of public, and the first source of information often becomes the preferred source. So therefore, information coming from media, from rumor, or from word of mouth, uh, sometimes it play a different role. So how to prevent that, how to mitigate that? So be first from the public health responder side or public health system side, be the first to give that information, and be right. So be right means accuracy establishes credibility. So information can include what is known, what is not known, and what is being done to fill in the gaps. So it does not mean that you are communicating, if any event is happening, that you are communicating, no, we are going to we will save lives, we will not let anything happen. So but you need to be very accurate so that community, you establish your credibility. If something is not known, then you need to communicate that yeah, means system is trying to find out what is happening as quickly as the information we will have or scientific evidences we will have, we will share with the community. So these are the things which build the trust within the community. And the other thing is the credibility. Credibility means honesty and truthfulness. It should not be compromised during crisis. So we need to be very honest and truthfulness to the community while we are sharing any information. Express empathy. Empathy, again, crises create harm, and the suffering should be acknowledged in the words, addressing what people are feeling and the challenges they face. Build the trust and rapport. We need to feel, while we are responding, we need to wear their shoes so that we understand their problem. We need to feel their sufferings, then only we can express our empathy. And promote action, community or people, meaning things to do, calm anxiety, help restore order, promote some sense of control. So we need to promote those actions. And also show respectful communication is particularly important when people feel vulnerable. Respectful communication promotes cooperation and rapport. Consideration in behavioral change. Does telling people what to do based on scientific evidence always work? No, it does not work always. Telling people that to do, however, scientific does not always work. Engaging them is more effective than telling people, what to do, and however, what are the scientific evidences. So these are the some of the, learning lessons to consider in behavioral change. People live in unique social, cultural context, and different dynamic relationships, their own perception of taking risk, vulnerability, and also trusted sources of advice. So these are all influence, whether they accept the health advice or scientific advice or not. So therefore, this is very important. Everyone has a right to know about risk to their health and well-being. And we are, this is our duty to tell people the right thing. And culturally appropriate information can help in making informed decision to reduce the health risk and vulnerabilities. Even if you are already familiar with the community, we need to remember that, and please do remember, each community is a, heterogeneous, and we need to keep in mind that, community, their heterogeneity, having their own unique culture, beliefs, and there is a need to understand and engage with them appropriately. And in this slide, just want to convey that we must make every effort to reach out to the community, their own vernacular language, because sometimes English and Hindi or local dialect, not their main language of communication. So we need to understand their whatever we are communicating, sometimes communicating in English, they take differently, they perceive differently, they act differently. So even sometime in the Hindi, so in the local language, that's why the community mobilizers or Surya Prakash are also mentioning, CBOs, community-based organizations, non-government organizations, and community mobilizers. They play a very important role because, they convey and they share, these evidences or messages to their own language, so that community can perceive things in their own way, act on their own way. So this is very important, part of the community engagement. How to, the benefit of the community engagement is strengthening communities, the cohesions, strengthening accountability and partners and coalitions, and also, when we have those strong engagement with the community, it improves service delivery. Many times happen, you have right thing to share, to deliver to the community. However, community is not taking those services or deliveries. So if we have a strong engagement with the community, it improve service delivery and efficiency as well as effectiveness of our interventions, and as well as it improve health and social outcomes of all the public health or disaster interventions. This is a matrix of community engagement continuum, and community engagement can also be seen as a continuum of community involvement. Over time, a specific collaboration is likely to move along this continuum toward greater community involvement, and any given collaboration is likely to evolve in other ways too. Most notably, while community engagement may be achieved during a time-limited project, it frequently involves and often involves into long-term partnership that move from traditional focus on a single health issue to address a range of social, economical, political, environmental factors that affect health. Community engagement during the different emergency phases, we have different emergency phases starting from prevention, mitigation, response, and recovery. And those are the phases, even in the early phase of preparedness, how we are engaging with the community, what are the tools, what are the ways we are using with engagement, and also in the initial response, whether we have been able to advocate, we have been able to take community, uh, community as a part of responders, or they are supporting your response, as well as their later phase of response. Sometimes it happens crisis, and whether community are ready to take that crisis, so that they are part of your response. And also it helps, feedback, monitoring, and also it improve your response actions. And same way in the recovery and evaluation part, how we are informing, how we're adapting. So we use different type of tools, uh, even evaluation also, like the after action reviews, or some lesson learned from, and documenting those lessons learned from this response, so that if any future emergencies happen, community knows, and community know that, what they have to do in different phases of emergencies. So that's why this documentations and lesson learned or publication of these things are very important. Preparing why, who, and where. It's a crucial to have comprehensive knowledge, understanding of the community, because of the different factors, cultures, practices, in order to develop a community engagement plan in case of emergencies. It is important to identify key people key group as well as focus group to understand their position, role, interest, priorities, as well as three levels we say always: home, community, and health services. And sometimes community influencers are very important because they play a key role in engaging the community and understanding the social landscape. We prepare for preparedness and response part. This is a rapid assessment. I will not go into the details of the steps, but collecting the information, then planning the assessment, engaging with the community for the dialogue, and then once you have all ready information, then you analyze that information and interpret that information, and as well as share that information, to the stakeholders of the community and other stakeholders. Shift tactics for effective community engagement. For effective community engagement, this is you can see the following shift. Community or individual is in reactive state of mind, so we need to be help them to create a receptive state of mind so that they are they are ready to support you, they are ready to respond. Using messages to communicate, creating two-way communication. Sometimes it's not, one-way communication is not important. Uh, Even in this webinar also, you might have been seeing from the coordinator side that, we need to have a two-way communication so that, uh, whatever thing we are sharing with you, you are receiving that information. And if that information is not getting through, then, you can communicate. Similarly, in the emergency and response, we need to have two-way communication. Whatever you are sharing with the community, whether the community is taking that or not, or sometimes community gives the feedback whether our response efforts are working or not. So that's why this two-way communication, and also telling communities and individual what to do. So this is a shift from what to do, listening first to their concern, their perception, and once you hear their concern and perception, it builds the trust, and that help you to take further your response based on their advice or their recommendation. Community engagement is also encouraged by Prime Minister's 10-point agenda. The number 8 point is mainly on building on local capacity and initiative to enhance disaster risk reduction. And disaster management must build on local capabilities and initiatives. The task of disaster risk management, particularly in rapidly growing economies, is so huge that formal institution of the state can at best be instrumental in creating the enabling condition. Specific actions have to be designed and implemented locally. Such efforts reduce risk, create opportunities for local development and sustainable livelihoods. Localization of disaster risk reduction will also ensure that good use is made of the traditional best practices and indigenous knowledge. So this makes our community self-reliant or Atmanirbhar community. And community must be strengthened by developing their capacity so that they are the first line of responders, which in the previous presentation also Surya Prakash sir has mentioned. So this is all from my side. Over to you, Anilji. But before that, I just want to give a takeaway message to our online learning community that uh, what are the takeaway messages from this 20-25 minute 30 minutes presentation, that community must be strengthened by developing their capacity as they are the first line of defense to any disaster or public health emergency. Community-based engagement is critical to build climate action and achieve India's target in Sustainable Development Goals, Sendai Framework for Disaster Risk Reduction, to which India is a signatory. Community must engage as a partners and a stakeholder in all initiative, starting from the planning process to the implementation and evaluation as well as monitoring, and timely information to provide situational awareness and guide action, and also a strategy to deliver clear, consistent messaging across networks and the public, so that community become a partner, not as a receiver. So empowering the community, taking learning or taking messages from the 10 point PM agenda, Sendai framework. So all those things, always giving emphasis on building the community capacity, taking community on board, and community first. Thank you. Over to you, Anilji.
Thank you. Thank you very much, sir, for providing insights on the community engagement in public health emergency and disaster management, covering the basic ideas for the involvement of community to the advocacy for the community engagement by our national as well as international frameworks. So, sir, there are a couple of queries from the participants.
Yes, please.
As mentioned, communities have unique characteristics. Does it mean that we need to develop different plan to engage the community depending upon their unique attributes?
Yes, well, I would say yes, because sometimes it happened that uh, some of our efforts will not work in all the community, means all the society. So some communities have different attitude, different beliefs, different perceptions. So accordingly, we need to adapt our prevention, mitigation, and response efforts in that directions. However, some of the basic or universal or common principles are same. Just adapting them to the localized or community adapted or community enabling efforts. So I agree, we need to adapt those interventions so that community can receive that as per their belief, their attitude and practices.
So next question is, what local community needs to do to be prepared for any impending pandemic like COVID?
Yes, I think this is a great questions specific to this ongoing COVID-19 response. Still, this pandemic is not over, and we have undergone in different phases or different surge of COVID-19. We have seen Delta, we have seen now Omicron. So all those, still this is not over, and communities has to be ready for future surge also. So what are the public health interventions? What are the community interventions, like uh, uh, social COVID appropriate behavior, how community adapting those, how community are taking those social, COVID appropriate behavior into the practice. We need to adapt them into the practice. We have seen, once cases are going down, people start removing mask, or if they are wearing mask, we have seen wearing mask, not wearing a proper mask, well fitted mask. Sometimes they hang in their chin. So what are the public health interventions? What are the government's guidelines? We need to follow those guidelines, and how to mitigate, how to prevent and mitigate. Everyone has to take a vaccine. Vaccine is very effective, and as well as what are the community interventions. We have seen many villages and many communities, they have developed their own community quarantine or isolation centers, and they started doing practicing social distancing. So and also sanitization, proper hand washing, all those interventions which has been time to time, shared by the government, and as well as WHO. Those things we need to follow up, and also some of our traditional practices, which are very effective, need to follow strongly. Over.
Thank you very much, sir. That's all from the Q&A sessions. So once again, thank you very much for pausing your busy schedule and joining us and sharing all the valuable knowledge with us and with our participants. Thank you very much, sir.
Thank you. Thank you.
Before moving to the final vote of thanks, I will request participant that we have shared a feedback link in the chat box. So all are requested to kindly fill that feedback so that we can know your suggestions or your comments on this ongoing webinar series. So with this, we draw the curtain of today's webinar. That was on community engagement in public health, emergency, and disaster management. Before saying the adios to you all, I take this privilege to propose vote of thanks. So at the outset, we would like to thank Professor Surya Prakash at EOC, GMR, NCBR Division, NIDM, and Dr. Rajiv Sharma, Public Health Specialist and Lead Emergency Management, CDC India, for providing us this opportunity to learn and to gain from their respective various vast knowledge, experience, and expertise. We are also grateful to the patrons, Shri Taj Hassan, IPS Executive Director, NIDM, Dr. Meghna Desai, Country Director, CDC, Country Office, India, and Sujit Kesing, Director, NCDC, for their direction, supervision in organizing this whole webinar series. We also express our sincere thanks to course Chair Dr. Himanshu Chauhan, Joint Director and in charge IDSP and CDC for his continuous encouragement and guidance. We also thank our participant, our online learning communities, without whom this event wouldn't be possible. And in the end, we would like to thank the team from CDC and GMR Division and ITM for their continuous support and collective actions in organizing this whole webinar series. So on next Wednesday, we will be coming up with a new theme with new ideas to share with you all. So I will once again request you all to kindly block your time for that webinar on next Wednesday, that is on 6th July 2022, between 2:30 p.m. to 4 p.m. So we also received some query from the participant regarding the e-certificate. This query was from Mr. Pankaj Kumar. So once again, we request you, if you want an e-certificate of participation for this webinar. So for that, you need to register yourself at NIDM training portal, and you need to enroll for that particular webinar. And after enrolling, you can there are that it is mandatory that your presence should be more than 60%. If you fulfill all the mandatory guidelines of NIDM, then you can yourself download the e-certificate from NIDM training portal itself. So for once again, I would like to inform that for e-certificate, you need to register at NIDM training portal and you need to enroll for that particular webinar. So we have also shared a feedback link in the chat box. So for that, we will keep active this link for a couple of more minutes so that each and every one of you can fill that feedback form. So thank you all for joining us.